In this video, we're going to be talking about asthma attacks. Asthma is a really severe condition, and we see quite a number of these coming into A&E every year, and predominantly in the winter months. It can be life-threatening, and certainly a number of people die every single year from asthma attacks. So it's a really serious condition that we should know a little bit about. So in this video, we'll cover what asthma is, and what happens during an asthma attack, so you get an idea of what the underlying physiology and pathophysiology of asthma is. In order to understand asthma, you need to understand a little bit about the anatomy of the respiratory system. In this picture, the airways slowly get smaller and smaller. You start off, trachea here, and then it breaks off into the bronchus, and then from the bronchus it breaks off into the smaller and smaller airways, until you get to the sacs of gas, which are the alveoli, which is where gas exchange happens. Now, you can imagine that these small airways actually don't have a lot of diameter, so for air to move in and out, it's a lot of resistance. And the problem in asthma is that these small airways become inflamed and the muscles around them start to spasm, and as such, the very small caliber they already have becomes even smaller. So it's sort of like trying to breathe through a straw. So if you imagine putting a straw into your mouth and then trying to breathe in and out really fast, it becomes really difficult. You need to put a lot of effort in to move the air in and out. Well, that's exactly what happens in asthma, although instead of the straw being at the mouth, the narrowing happens inside the lungs, inside the very small airways. And you can see this diagrammatically here. This is a normal bronchus here. You can see that there's a smooth muscle that sort of covers each of the bronchi, and that's to open and close them. And then you've got the wall, and there's a bit of muscle around this wall, and then you've got cells around that. Now what happens in asthma normally is that this becomes thicker, so you can see this diameter here becomes smaller because you've got much more thickening of this interstitial area. In addition to that, you've got thickening of the muscles here. The smooth muscle becomes much thicker as well. So even at the resting state, the caliber of the airway has got smaller in asthma. Then, when you get an asthma attack, something triggers the smooth muscle to contract down. This is what we call bronchoconstriction. And the combination of the constriction down of the small bronchioles and also inflammation, swelling that happens in the lungs, in these bronchioles, cause even more swelling and therefore even more narrowing. This is important because actually part of the problem is that the smooth muscle itself contracts down, but the other problem is that you get swelling, edema. And the best way to think about that swelling is if you imagine someone having an allergic reaction, you see their lips swelling, you see their skin swelling, and you see the redness. Well, that's exactly what happens inside in this yellow part of the alveolus. So in addition to the muscles contracting down, you also get swelling of this interstitium. And the combination of both of those make it more difficult for patients to breathe. So it's worth thinking a little bit about what the triggers to asthma are. And there's a number of different triggers. One that you've probably commonly heard about is cold weather. And as the cold, dry air hits the lungs, you find that it just causes that reactionary constriction. And this is mainly the smooth muscle that constricts down. Cold weather doesn't really cause inflammation as much in the bronchioles. Pollution and lots of different gases and toxins can cause irritation of the inside of the lungs in the bronchioles. And again, this can cause both bronchoconstriction through the smooth muscle constricting, but it can also cause inflammation of the interstitium within the bronchial wall. Very commonly, pollen can cause people to have lots of allergic reactions, and there's a very common trigger for people having asthma, which is why you get a seasonal increase in asthma in the spring and summer months. Probably the most common reason for an exacerbation of asthma, for an asthma attack, which comes to hospital, is an infection. This can be either a viral or a bacterial infection, and the resulting inflammation causes more and more inflammation and hyperreactivity of the small bronchioles, which then cause the patient to find it more and more difficult to breathe. And about 80% of the patients that we see in A&E are triggered by an infection such as a virus. So what happens in an asthma attack, like we described, is that the smooth muscle starts to constrict. The wall of the bronchiole becomes more and more edematous, and all of those things cause swelling and therefore narrowing of the airway. As you get swelling, as you get inflammation, the other thing that starts to happen is you produce lots of mucus. And so you can see here this green fluid, and it just fills up all of the bronchioles. So you can get what we call bronchiolar casts, lots of mucus plugging off all of these different areas, very similar to what you get with an infection. And so this is why patients with very severe asthma attacks can start to become very low on oxygen. It's because all of the alveoli are being blocked up with lots of mucus. And it can be very difficult to clear this, and it can take weeks and weeks for the mucus to completely clear, even if the bronchoconstriction has started to relieve itself. And the problem here in the production of the mucus is really due to there being inflammation and hyperreactivity. So since we talked about the different ways in which the asthma attack causes narrowing of the bronchioles, it's worth thinking a little bit about how can we treat asthma? What drugs can we use? Now, when you think about this, it's worth thinking about the two different things that are happening. One is constriction of the smooth muscle around the bronchioles, narrowing the caliber of the bronchi. But the other thing is the inflammation, the swelling that happens in the wall of the bronchus, and how we can try and mitigate that. And the third thing to think about is what happens as a result of that inflammation with the mucus that plugs all of the different airways and cause the amount of oxygen transferring into the blood to reduce because you're blocking off access to different alveoli. The other thing that's worth thinking about is we see a lot more asthma in young children than we do in adults. And it's worth thinking a little bit about why that is. What the potential reasons for this could be. We'll address these questions in the next video.